You are listening to Sean Harrison on Amp Life Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.
And hello, everyone out there, both in Facebook land and podcast land. Now, I want to get something clear. You over there in Facebook land, I'm pointing at you. You probably heard something there. So I'm testing the new setup that I have now, because typically when I'm listening to what's coming through my headphones, you don't get to hear it on Facebook because of our new setup. Well, I think I got it figured out. So now you will hear everything that I'm playing through the system, and I think it will make a better listening experience for you. So welcome back, everybody, to another episode of Amp Life Talk Radio. Hey, I do want you to let me know if you're getting any type of feedback, which I don't think you are. You might hear some on my end, but I got everything kind of low and adjusted. But Facebook, you should hear me pretty well. Now, for all of my podcast listeners, we will test this. Hopefully, this show here will not have a lot of distortion and echo in it. If it does, I'm going to have to reach out to my main man, Rich. Rich is responsible for that wonderful opener every time that you guys hear when I start the show. My main man, Rich Harris, over at Soul Effective Productions. He helps me with a lot of my sound and all the little clips that you hear. Tonight, man, I got to tell you, it's one of those shows to where it's a heart show felt for me, because I'm talking from a topic that I see on a daily basis. In fact, what kind of brought this show front and center was the fact that I had one of my coworkers who's in Sacramento. We kind of got this show going, and you're going to hear what happened with this. So as you can see, the title, we're season 3, episode 22, and it's simply titled Failing Amputees Healthcare. We're going to talk about that because you're probably wondering, what is Sean going to be going off about tonight? Well, it's going to be pretty simple. We're going to be talking about our healthcare system and what I see as a drastic need that is not being met to help all of you out there, my fellow amputees out, as I come across you in my daily workings. I'm finding that there is a huge gap that needs to be filled. So let's get on with this show and start talking about that. I'm giving everybody my stink eye over on Facebook, if you guys don't know. Oh, being a little bit silly tonight. So welcome, everybody, to another episode of Amp Life Talk Radio. If you are out there living with limb loss can be very challenging. You have questions, concerns, and feel alone in this process. Well, I'm Sean Harrison, certified peer visitor and counselor, about to be a certified life coach. Hopefully I'll have that done by the end of the year, maybe next year. We'll see. I'm your host for this show. I will be your guide as we walk down this path, as we go through this process, having someone along with you along this process as a new amputee, and even if you've been an amputee for some time, is always a better experience. As we become acquainted doing these shows, talking with each other, sharing with each other, I am here to assist you, to provide information. My goal with this show is empowering amputees to reach their full potential through communication, education, and inspiration. Amp Life Talk Radio is a talk show for amputees and those affected by limb loss. That includes all of you caregivers, wives, husbands, children, and family members and friends. If you are an amputee, I want you to know one important thing. You're not alone. There is one thing that gets under my skin. When I hear a healthcare trained professional being a dictator of a patient's rights that really chaps my hide, man. That really gets under my skin, gets my goat going. But I have to hold my tongue because most of you know I work for Hanger Prosthetics, but I am an advocate. And it's tough playing both of those roles because I want to fight and stand up for patients, but yet I have to represent my company in a very positive manner. Too often I come across a medical administrator or sometimes a director of physical therapy telling me what's best for a new amputee. And I give them this look like, what are you talking about? Especially when you're talking to someone who has no clue about limb loss. They have all their body parts, they're an able-bodied person, but yet they're trying to sit here and tell me what's best for the amputee. I've been doing this almost 6 years now. In these days, one of the things I see, especially in the days prior to amputation, immediately after the amputation, is that amputees are left in limbo because of these administrators, because of these dictators of health, because they have no clue what's best for the amputee. I am very blessed that I'm in an area, the Central Valley, and I have worked here for over, the past 4, 5, 6 years, educating doctors, physical therapy staff, administrators, case managers, social workers, and admission staff, who I work very closely with in this area, of the importance of having a trained amputee peer visitor, advocate, or peer counselor, as myself, involved with the care of a patient from the start or as soon as possible once the amputation is performed. As I was doing research for the show tonight, I was coming across pages where I see support groups for everything, man. Support groups for dogs that have lost limbs. Like sitting here going, are you kidding me? Hospitals have support groups for burn recovery, cancer patients, uh, man, what else did I see? Prostate cancer, brain tumors, smoke-free support groups. These are all inside the hospital, put on by the hospital. They have support groups for just about everything in a hospital. But the one thing that most hospitals are lacking is a emotional support group for amputees, or even calling someone in like myself. If you can't afford to do a program, get to know who your local person is that does this. I have worked very hard at getting to know everybody from Sacramento to Fresno, and that is a big area if you live in California. There isn't not too many people that don't know about me and what I do. So I'm very busy, but it really upsets me when I see some of the bigger healthcare facilities such as Kaiser, Sutter, and Doctors Medical Center, even Dignity, not doing what's right for amputees, not making this a more important issue for amputees. I'm blown away. I do have certain people in some of these facilities that I do get calls from, but for the reason for this show, a fellow employee in Sacramento was called out by administrators in Kaiser for helping an amputee patient, for which he was called by the physical therapy staff to assist this patient, because upon their working with the patient, they discovered he might benefit from talking to someone. And to have an administrator tell a person who's trying to help this guy, you're not allowed to help him. And he's not going to deal with that kind of stuff for the next 3 months at an amputee clinic where all the reps can then talk to him. That's the thing I got a problem with. It's no longer about care and helping the amputee. It's all about money. The prosthetic industry, the P&O industry, yeah, man, but it should not come at the sacrifice of a patient's emotional state. That's what we're going to be talking about tonight. It's clear that amputation affects limb loss survivors in a very physical way. That's obvious. But the emotional and psychological impacts of limb loss are sometimes just as serious as the physical ones. The relationship between amputation, grief, depression is very real, often very strong. So why don't hospitals take this more serious? That is a good question. We're going to look at that tonight. Amputation seems to be lost in the healthcare system because there is no big money research behind it, unlike cancer and some of the other things. I'm just very disappointed to see how some of these facilities, these healthcare people, take this and how they do this. What's going on, Robert from Manchester? Is that New Hampshire? We got Robert on Facebook here. It's very disheartening when I hear stuff like that. And I have to say, shame on you, Kaiser, for doing that. Shame on any medical professional for putting off the care, the emotional care of any amputee because, I don't know, whether you just don't know it, you don't see it as something as being important. It's crazy to think that you're a medical professional and you don't understand amputation affects a person physically and both mentally. I'm at a loss for words on that. That's why we're doing this show tonight. I hope that you guys will stick around and hear what I have to say about this. Hopefully we will all learn something. I would love to hear from your comments over here on Facebook. I'll respond as much as possible. And remember, when you say hello over on Facebook page, the Amp Life Talk Radio page, always give a shout out where you're from so I can say hi to you and everybody in the room can know where you're from. But seriously, what happened to patients' rights? What happened to taking care of the patient both physically and emotionally after a traumatic experience of losing a limb? What is going on with our medical professionals? Are they letting medical professionals decide what's best for a patient and scrapping the patient's rights? We need to really rethink this and look at this. Adjusting to limb loss is more than just the physical pain that people suffer.
Sean Harrison.
As we get into segment one, yes, those of you on Facebook, if you don't know, you can hear everything now. So you might hear me taking a drink of my water. Hopefully you hear the tunes that I play in between each clip, just so I can do different things like that and set up my next segment, find my place. If that is coming through good for you, just give me a thumbs up over on Facebook so that I know you are hearing that. Let's welcome, is that Brady? I hope I got your name right. Hello, you're from Queens, New York. Welcome to the show. Welcome to Facebook. Segment one, we're going to talk about the impact of amputation. Now that's a big subject right there. I tried to break it down, keeping it in scope of what we're talking about tonight. From an older person with diabetes to a teenage survivor of a traumatic injury, most new amputees feel alone, depressed, and isolated. Sharing experiences, challenges, and fears with a trained, certified peer visitor or counselor, in my case, can reveal solutions can give hope and open up new possibilities for the new amputee. So, why do hospitals seem to be so behind with this? I have a big problem. How does an amputee pass through emotional pain, stress, grief, and depression all on his own while in the care of the hospital, and no one thinks about having him speak with a amputee peer visitor or counselor to help him with some of these emotional feelings that he's going through? As you all know, doctors, friends, family all pass through these phases of grief or this phase of grief and share their sympathy with the new amputee after an amputation. But few persons could really understand the mindset of the person who is undergoing this trauma, this life-changing event. I mean, really, how can they know? The loss of a body part can have distinct but overlapping psychological consequences. These can be bodily changes, alterations in the way the patient, their family, and others perceive the patient himself, how he looks, how they perceive themselves, how they perceive their body. Or it could be changes in function, alterations in the activities and roles that they play in their life, in their family's life, that now they're not able to carry out. Some types of surgeries affect one or more than the other. We're looking at other health issues on top of the amputation. All these affect the patient emotionally. Patients that undergo an amputation often have challenges with emotional adjustments to the limb loss. There is a huge body of evidence that the most effective way to assist a new amputee patient with the transition to life after limb loss is through peer support. I'm going to say that again because I want any medical professional that's out there listening to this show, I want you to hear what I'm saying. There is a body of evidence showing that the most effective way to assist a new amputee patient transition in this on this path into their new life after limb loss as a new amputee is through peer support from individuals who have successfully moved forward after an amputation. What does that mean? What it means is this. Typically, a peer visitor is someone who has been an amputee for at least 3 to 5 years. They have successfully transitioned into that life. They will probably be more beneficial to an amputee, a new amputee, in helping him understand the roller coaster of emotions that he's about to experience. Add some training to that amputee that's seasoned now, and you've got a great resource to help amputees out. Why we are not using those guys, I have no clue. I don't know why we don't use amputees in that way. I know I'm very lucky to have a group of professionals who call upon me. In fact, I just came from Fresno today seeing 2 patients because surgeons called me yesterday to come out and see patients. And I went out to do my peer visits with them. And let me tell you, the world of difference it made, not only for the patient, but for the family members that showed up during the visit. We need to change the mindset of administrators and hospitals who don't see the importance of this. Segment 2, limb loss and grief. When we talk about amputation, whether traumatic or health related, Many amputee survivors go through grief, a grief process. Let's talk about that for a little bit. From my experience, there are three phases I see of emotional pain in amputees as they ride this roller coaster of emotions. Non-acceptance, trying to come to grips with the loss of the limb, trying to say, what's going on? Wow, I don't have a limb. I don't have my leg. I don't have my arm. The non-acceptance phase. This first stage of emotional pain after amputation, this stage begins right after the amputation. The day of the amputation, the traumatic accident, if they were in an accident, the accident itself, and it may persist for weeks or several weeks. In this stage, initially, no amputee can accept the reality of what has happened in their heart. They're struggling with it. They're having a really hard time with it. This is why it's so important to get someone involved as soon as possible. They are in a state of shock that is felt commonly when loved ones die. They know that it's their loved one, their leg, their arm that's gone, but they don't want to believe that fact. They don't want to accept that reality. They're struggling with it. They can't wrap their heads around it. This phase might be described as a safe themselves from the sudden rush of emotional grief and depression that is inside of them. And it acts like a mental and emotional cushion, like a pillow, the non-acceptance. This is the stage when the amputee needs the greatest support and empathy and attention of family, friends, medical staff. This is when a trained amputee peer visitor or counselor should be introduced to the patient. This is where most, not all, medical professionals get a failing grade. This is where they fail because they don't understand or underestimate the power of another amputee who is trained in helping a fellow amputee deal with limb loss. Here's something that most of you don't know or realize. The eye doesn't see. The brain actually sees for you. The eye just transmits. The brain translates the information it receives from the eye into something that we can understand. Now, do you understand why it's so important to have involvement of a successful, trained amputee, peer visitor, and counselor involved as soon as possible? Remember, the eye doesn't see, the brain sees. And I cannot tell you how many times I've walked into a room, started my peer visit, I'm talking with the patient, the family, and I finally get to a certain point where I say to the patient, as I'm looking at them and I'm trying to explain this process to them, and the patient's looking at me, and I don't see that click just yet. I don't see it because we're talking about all these things. And then I start saying some keywords. I can relate to you. I understand. I was there myself. And then they kind of sit up and start paying attention because they want to say, what in the H are you talking about, man? You got all your legs and limbs. And then I say to them, did you know that I'm an amputee too? Most of them think they heard me wrong. And they say, what? And I say, I am an amputee also. They sit up, they look down. They go, no, where? Well, you don't look like it. I go, yes, right here. I lift up my pants leg. That transformation It's just what I read to you. Here's something that most of you don't know or understand. The eye doesn't see. The brain actually sees, translates that information for you. That's why it's so powerful to have an amputee go talk with another amputee. Because once that information is uploaded into the brain and they see that image, it motivates them, gives them hope. It changes their perspective. Why we don't get amputees, trained amputee peer visitors involved sooner with amputees based on this information right here, I just don't have a clue. I'm baffled. Gradually, as days pass, the amputee accepts it. And then the second phase appears and starts. We just left the non-acceptance phase. The emotional phase starts to happen. This stage is always with us as an amputee. We're always emotional about our limb loss. We have our good days, we have our bad days. Anger, anxiety, grief, depression, stress. Or in other words, the emotional roller coaster that we all ride on. And you know what I'm talking about. In this second phase, the amputee has to accept the fact that their emotional levels are all over the place. Things are just haywire. They don't know if they're coming or going. And if you are a family member with a new amputee like this, you are going to be on part of this roller coaster with them. So this is a very important phase. We set this phase up for a very positive and successful outcome if we have introduced the amputee to another amputee who's trained, a peer visitor, and who's going to help assist this amputee through these phases and through what we're going to be talking about. The emotional phase, again, stays with us lifelong. There is a phenomenon that amputees undergo: anger, frustration, fear, uncertainty, embarrassment, regret, worry, grief, depression. I mean, there's a list, man. There's a laundry list that they go through. Again, remember, this phase is called the roller coaster. We go through so much. Anything can set it off. Anything. A look from someone, you looking down, a quiet moment. Gradually, the amputee does start to learn to accept the fact in their heart and begins to overcome the emotional conditions and tries to start the life with their new reality. Stage 3, the stage of physical and mental rehabilitation. Did you hear what I said? The stage of physical and mental rehabilitation. Again, I want medical professionals to understand we can't just rehab the body without the mind. You got to have both for successful outcomes. This is the stage of physical and mental rehabilitation. The great thing about this, if you get an amputee involved pre-op or immediately post-operatively, this phase becomes a little bit easier for the amputee. As they're doing the physical rehabilitation, that is going to help them as well as the mental. This stage is the stage that rehab is supposed to help the amputee. By now, you have already been approached by, more likely, a physical therapist. You've met your physical therapist. especially if you're even in the hospital. They start that right away. A lot of amputees, and a lot of times I hear amputees are not having anything to do with that right after their surgery. So it's always kind of good to have a certified, trained peer visitor come in and break the ice. Let them know what to expect. Expect a physical therapist come into your room immediately after your amputation. Your physical therapy begins right then and there, unless you have other elements going on to where you can't participate in that. Hey, Clarence, my man, what's going on? Loganville, Georgia. Man, hey, Clarence, I'll be looking at that food you be cooking, brother. Welcome to the show, Clarence. Good guy there. So, in this stage, physical, mental, rehab, both are so crucial, both are very important. They work hand in hand. They really do. Because during this phase, new hope is the goal for the physical therapist, to give you some hope and inspiration on being able to transfer and do some of the new things you're going to have to do to start in this new life you'll have. But emotionally, you got to be ready for it. You got to know what to expect. The best way to know what to expect and to be ready for it is to have that certified peer visitor come into your room. And when you start looking at both of these hand in hand, sometimes the physical and the mental aspects of rehabilitation can spark new hope. It can rekindle that fire inside you. It can rekindle that hope, depending on if the new amputee has been introduced to a trained amputee peer visitor. Physical rehabilitation is more successful if we address the mental rehabilitation as well. As they learn new physical skills to cope with their new situation, I always call them habits. You're going to learn new habits. The confidence should be building up in a newer, better way as they begin to learn how to do things with their new normal. Segment 3, coping, management of emotional pain of amputees. Coping. Coping is such a key word. Management of the emotional pain of amputees. Remember, amputation is not just physical. We have to break this mentality of medical professionals and those in the healthcare industry to stop looking at things so one-dimensional when we're talking about the care for our brothers and sisters out there that are going to be new amputees and coming into this world. Karen, welcome. Miss Owens, Louisville to Kentucky. Uh, Welcome to the show, Karen. Um, Hey, you guys got some good food too. You can tell I'm hungry doing my show, huh? Yeah, I'm on this diet getting ready for the Spartan races, man. It's killing me, dude. I want to eat some good food. And Clarence, don't you be putting no ribs up on Facebook, man. I'm gonna kill you, dude. You start doing that because you be throwing down, brother. You be throwing down. Okay, so as we're going through this, and we get into segment 3, we're talking about coping, management of the emotional pain of amputees. Okay, there's a couple ways this happens. Keep in mind the emotional pain. Medical and surgical help. Immediately after your amputation, you're probably going to be on some drugs. You're probably going to be on some good medication. Uh, they are needed to help with amputation pain. You could be on painkillers, antibiotics, or other drugs, gabapentin or rotin, depending on what it is. They will always be administered by a qualified, certified, trained medical staff member or nurse. Now, in the acute stage, most amputees sometimes get help from uh, the anxiety that they're feeling, antidepressant drugs, keeping in mind the current environment of narcotics in the United States, you're not going to get as much as you think you're going to get. So you are going to be in a little pain. But we have to learn to distinguish between the two pains. Immediately after surgery, you're going to feel a lot of stuff. You may feel phantom pain. You may feel the amputation pain, which is your surgical pain. There may be a number of things you feel. Having someone there who has been through this will help you understand what a normal is. You will accept that better as a new amputee, hearing that from an amputee who's up and walking and moving, who's been where you have been, but made it through it, because you're thinking at that point in time, I'm not going to make it. Oh my God, how do I deal with this? The pain is so much. And then seeing somebody who is right where you are at, and they're up and they're walking, it helps. Remember, guys, your eyes don't see, they merely transmit to your brain. It's your brain that sees. The reason that's so important is this. I'm going to tell you a story. Most of you know I do Spartan racing, some of the toughest stuff on the planet. Some of the best athletes in the world do Spartan racing. As a person with a right below the knee amputation, I do Spartans. Doesn't help that I'm 53 years old. I'm not some little skinny spring chicken, okay? Spartans are tough. They are hard. One of the things I have learned is this. I don't pay attention to what my eyes see. I pay attention to what I want my brain to see and hear and know. It helps me work myself through that process and cross the finish line. Your brain is the most powerful tool you'll ever own. Seeing is believing. Having someone who is a certified, trained peer visitor amputee come into the room, help the amputee through this process is what we need. Adjusting to limb loss, it is the most powerful thing you can do for an amputee. Why our healthcare industry has not embraced this like they have cancer, burn victims, and really put money behind having a good support system in place, emotional support system in place for new amputees. I'll never understand it. 2, emotional support, as we're talking about coping, management of emotional pain of amputees. The support of a family, friends, plays a great role. It has the power to shorten the second stage of mental strife for amputees. The important role of this support system is valuable in helping the amputee overcome the helplessness feeling that does affect amputees. The family should support in a manner that provides full physical support, but at the same time should provide emotional support in such a way that the amputee might gradually have emotional independence. Be independent and feeling a loss of control of their lives is one of the most frustrating changes that people experience after amputation. Third, physical rehabilitation. It does, or it doesn't merely enable the amputee to gain independence, but it uplifts the mind as you conquer certain tasks and goals throughout your physical therapy, knowing that you got this, you can do it. The new hope emerges, and confidence will increase as you see yourself able to do these things. Because remember, in the very beginning, there's the non-acceptance. And part of that non-acceptance is, I can't do this. That's why physical rehabilitation is so important. Fourth, mental rehabilitation. We discuss both of these. I want you to understand the importance of why both are so crucial and work hand in hand. This, to me, is the most important aspect by far of the care for and of a new amputee. But yet, many hospitals and healthcare providers have failed to understand this, or they just don't even care. People say what really helps in the long term is finding a positive meaning. This is new amputees and purpose after their amputation. And what better way to help them with this than having them speak with an amputee peer visitor or counselor who's trained, who's there just for them to help them? What better way to do that? What better way to jumpstart their care, both physically and emotionally? Along with the physical rehabilitation, some efforts are necessary for full mental, emotional, and spiritual rehabilitation. And you hear me say spiritual. We all have some type of spiritual vibe in us, whatever it may be. I'm not telling you what that is. Hey, maybe you connect with water more. You know, people love the beach, people are mountain people, whatever that vibe may be. It is evident that medical doctors have limited scope when it comes to this stage and tend to frequently use drugs to help the patient. We're talking about mental, physical. We don't want to do that. This fails the amputee miserably when we do this, medicating them. The most effective alternative is through peer support, helping an amputee, a new amputee, by putting him in contact with someone who has been successful at the journey that he's on. The emotions that the patient will go through, self-denial, pity, depression, lack of confidence, will be generally restored once they meet this peer visitor, as they help them. It's so important. It is such a crucial part of the care for new amputees. We need to make sure healthcare professionals understand this. Spread this message, guys. Spread it. Hey, have them listen to the show, man. But spread this knowledge because it's desperately needed in certain places. Segment 4, what's missing and why? Let's talk about that a little bit. So we've talked about what we see wrong, the failing healthcare, failing amputees, our healthcare system, certain providers. What's missing and why? Well, I think what's missing is this: emotional rehabilitation, education. Patients and their families should receive counseling and instruction in the important areas to help facilitate the readjustment process to a fulfilling life for the new amputee. Some of the topics that should be discussed and brought up if you are a peer visitor and you're out there seeing amputees, or if you are listening to my show and you got a guy that you know of and you want to help him, here's what I'll say to you. Best way you can help that guy, man, is this. Understand the medical, physical, emotional effectiveness of a peer visit. And keep in mind, a peer visit means listening, hearing somebody out. Nutrition. A lot of us, the health related amputations, I had a patient today, I could tell, not the best health. Nutrition, eating good, taking care of yourself, taking care of yourself. The adjustment to the disability. These are topics that and discussions that you can have. Vocational counseling if they want to go back to work. My neighbor, he's not an amputee, but he messed up his leg pretty bad, and he's going through this right now. And we talk a lot, okay? So it doesn't even have to be somebody with an amputation. You know, somebody who got a messed up leg and are limping and they see you walking around with no leg, of course they're going to talk to you and say, man, you walk so good, man, and I'm walking around with this bum leg and I'm doing all. It really helps, man, not just amputees. The ability and use of adaptive equipment, that's going to be a topic. Equipment maintenance. Yeah, yes, your prosthesis is a piece of equipment. It's a tool. Community resources. You've been out there for a while, or amputee peer visitors have been out there for a while, like myself. I have a lot of resources I share with my people that I'm helping. When I hear a need, I have a lot of resources. Most of you will know this if you go to amplifetalkradio.com and look under the resources page. There's hundreds of them over there because I run into so many different scenarios and needs of new amputees as I'm out doing my job. You, an amputee who's been doing this for a while, you yourself are a resource. Community reintegration. Getting back out, man. Getting back and living. Helping an amputee do that. It might be something as simply as going fishing, a walk in the park, meeting for a cup of coffee. These are things that we can do. These are things that can be done. These are things that are missing from our current healthcare system and providers who don't see the importance of having a certified, trained amputee peer visitor involved with every new amputee out there. Even some of the ones who've been an amputee for a while but never got this. These are some of the discussions and topics that I know will definitely come up and would help you. Clarence, I think you're asking me about a guy. Yes, please share, man. Um, this is what it's about, man. This is what it's about. Of course, last but not least, prosthetics and orthotics will come up. Each patient uh, should receive comprehensive discussion, their family member. If you have a book, some type of manual about amputation and rehabilitation, that includes information about self-care, cleaning, nutrition, and prosthetic use. Being able to talk to someone who understands where the amputee is at, what they are feeling, or offer real life advice, talking to someone who is, they've been there, talking to someone who is there to listen, a peer, a fellow amputee, who is a good listener, who has a positive outlook. We don't want doom and gloom, man. We want that positive person who's an amputee and who has your best interest at heart. The new amputee feels more comfortable to ask questions that he won't ask. He wants feedback. He'll ask those things. It is through listening, being a good listener to that new amputee comes to help you and to help them understand how they really feel. It's amazing how just by being a good listener, you help them process their thoughts, process their emotions, what their amputation means to them, and how to move forward. Just by being there, being a good listener, man. Outcomes. When we talk about what's missing, outcomes. We need better outcomes. Studies show that amputee or amputation survivors who have contacted or been in contact with an amputee peer visitor or counselor have a better chance of returning to the community as an ambulator and are able to better adjust emotionally to handle the amputation. Proven facts, man. Proven facts. The facts do not lie. It is a 100% fact, man, that if you can get someone involved early, you're going to have better outcomes. The amputee peer visitor will and should provide information and emotional support for the new amputee or pending amputee if you can get him preoperatively. Peer visitors are uniquely qualified to help amputees cope with negative emotions after an amputation because they have experienced the same emotions during their own recovery, rehabilitation, and journey process. Preparing for an amputation, the sooner the better. You get a certified peer visitor involved with someone who's about to go through an amputation or who has went through an amputation. Why? This, I honestly don't know why healthcare providers in certain hospitals don't see the importance in this. I really don't know why. I can't answer that question for you. I really wish I had that answer. The why, I don't know why. I wish I had the answer. But this show can be the answer. Share it, spread it, educate people. Patients get the short end of the stick way too often by the politics and the red tape of administrators and all the back alley deals with O&P companies. It's a bad deal. It's sad. It's really sad that the patient always gets the short end of the stick when we're talking about why this is not in place, why it's not the normal for amputees going through amputation. Conclusion, guys. Losing a limb should impact a person, and it will impact a person significantly, but it does not define or limit them. It is our challenge to find meaning, purpose, and hope in the face of this struggle and the struggles that we will find ourselves in. It comes easy to some and is hard for others. Changes imposed by amputation is going to be one of the things that a peer visitor can help out with. Changes in body image is one of the things that a certified, trained amputee peer visitor can help with. Changes in functional abilities is what a peer visitor, amputee certified peer visitor can help with. Changes in finances. Yes, it becomes hard financially going through an amputation. Other amputees might have pointers or tips, resources, suggestions. Changes in comfort, our comfort level changes. A fellow amputee will be able to provide some good information and answer those questions. As I wrap this show up, guys, I would like to thank each and every one of you for tuning in to another episode of Amp Life Talk Radio, a show for amputees and those affected by limb loss. Man, it is a blessing to share what I get to share with you guys on a normal basis. Makes me really excited to come in and do a show with you guys. Hopefully, this was a good show. You found some good information and you learned something. That's my goal, and that's what I try to do with each and every show. Keep in mind, guys, we are still going to be trying to do live call-in shows. I have a little trick up my sleeve that might work. If it does happen, you will be the first to know. Also, the newsletter. You guys hear me talking about that. I've been posting about it. Get over there, man, and register for that newsletter because I'm putting some really good stuff in there. You guys got to get it. So make sure you check out the newsletter. It's basically subscribe at amplifetalkradio.com. Subscribe at amplifetalkradio.com. I'll send you a link, and it's a digital magazine. You can flip through it and read it, do all that cool stuff. Again, man, thanks, guys. Hey, if you appreciate the show and you appreciate what I'm doing, please leave me a comment or a Facebook criticism. Leave me good comments. I appreciate it. Leave any comment. Doesn't have to be good. Just, hey, you appreciate the show, or you learned something, or hey, you want to hear a certain topic. Leave those comments over on Facebook. I really don't do a lot on Twitter. You will see some of my pictures and what I'm up to on Instagram. Go over there, AmpLifeCom, AmpLifeCom, on Instagram and Twitter, same thing. I hope you guys enjoyed this episode. If you would like to ask me any questions, feel free to reach out to me at Sean@amplifetalkradio.com, or just go on over to amplifetalkradio.com and drop me a message. I appreciate all you guys. You guys are wonderful. I'm going to try and cue us out of here with my my sound. It always pauses, man, but I get stuff in the post-production and clean everything up. I am very appreciative of each and every one of you. And I do not want to forget the Wall of Fame. Hey, I don't make money off of the show. So if you want to sponsor the show, go over to amplifetalkradio.com. There is a page there where you can sponsor us. I have one sponsor who has so kindly sponsored us with some funds. I will be putting together some of the gifts that I will be sending you guys to say thank you for sponsoring Amp Life Talk Radio. Thanks everyone for the love and support. I hope you enjoyed this episode of Amp Life Talk Radio.
You are listening to Sean Harrison on Amp Life Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.